of SCI, I welcome to all my friends and all my colleagues to attend the meeting. And the chairman, Dr. Secretary of the SCI, Dr. Sina, and Dr. Hajra, and Saroj Mondal, and Devdata Bhattacharya and Subhasis. Dr. Subhasis, please start your case.
Okay, sir. Can you see my screen?
Yes.
Yeah.
Okay, right.
Subhashish, just one thing.
Yes, sir.
Would have liked
Yes,
to
sir.
see you also, not only your screen.
Yes, sir. আমার ক্যামেরা নেই
Huh?
স্যার ডেস্কটপ স্যার ক্যামেরা নেই আমার
Okay, your voice is fine.
Okay, fine.
sir. Okay, sir, this is a very small case, so it won't take much time. It starts off like this: that I was called to the cath lab at around 9 at night with these images sent to my phone on WhatsApp. WhatsApp really helps nowadays. So one of my colleagues was doing a plasty, and these were the images that were sent. So something had gone wrong at the end of the plasty. Perforation, what it looked like initially, and by the time I rushed in, the patient was very stable with normal BP. We did an echo and there was no pericardial effusion. So a closer look at this image would show you that this is basically communicating with a vein. This PDA is basically communicating with a vein. So it was a heavy fistula and draining into a coronary vein and into a sinus. Starting the story from slide number 1, I'll show you these images. Just give me a second. Right. So this was what was attempted. It was a inferior wall MI, 55-year-old female inferior wall MI of some duration, 2 to 3 weeks. This was the angio. It was a 100% cutoff RCA. Just to complete the picture, these were the left shots. There was a disease in the LAD and the circumflex, and the operator was trying to do an angioplasty of the RCA alone. So the guide was engaged and a regular with a JR, but it would not cross. A regular wire with a balloon support would not cross. So he took a AL rightly and escalated his wire after even it didn't cross with the balloon support. So it took a Gaia 2, and the Gaia 2 managed to cross with balloon support like this. Okay. So this is the wire crossing. Please, sir, have a look at the pictures.